Today is president of Henry Ford Jackson Hospital and Central Market, Emily Moorhead. Hi, Emily.
Hi, good afternoon.
Good afternoon. Welcome back.
Thank you so much.
Yeah, nice to have you here. I think the last time you were here, you were interim president, but since then, I think December you got named as officially the permanent president.
That's correct. That's correct. Yeah.
Congratulations.
Thank you so much. Thank you so much. It's quite an honor.
When you first came to Henry Ford Jackson, you were as, I think, Chief Operating Officer.
Correct. Yeah. I've been serving this market for just over 3 years now, and yeah, it's just been absolutely wonderful and truly an honor.
How do you like Jackson so far?
Oh, I love it. I love it. What a wonderful community, and the way that the community has just rallied around myself, rallied around the hospital as a whole. It's a special place to be. I tell our staff that often. We have a wonderful culture and a wonderful community of support.
Great. We love to hear that.
Yes.
So the change in position came really at some very challenging times for the hospital, healthcare in general. Still in the pandemic, and almost your whole time there. Yeah. Pandemic.
Yeah. I started in January of 2020, so my orientation quickly started as a fire hose orientation, and but it was a great way to learn the organization and really see how people rally together. It was exhausting. Don't get me wrong, and it's not the sexiest time to be a healthcare leader, but I will tell you that it makes it easier when you have a great team and great staff all around you.
Yeah, so I don't even like to use the term the silver lining of a pandemic, because I don't think when people are dying, there's not a good side to that. But I think we got closer as a community to our health system. I think about the big parade down East Michigan Avenue with all the fire trucks and all the people bringing food to the to the healthcare workers, and the way that the hospital was first in the state to start testing people, educating people, all things. It seemed like we got closer. Our health system, Henry Ford, and the Jackson community.
Oh, I couldn't agree more. The way that we all rallied together, seeing what we could do, given that just the pressure that we were all under and making sure that we were keeping people safe. We have a very robust population health infrastructure. I truly believe that helped keep people out of the hospital. We set up the testing site within 24 hours of the emergency, the health public emergency hitting. And then, I think just the resiliency and the partnership of everybody in the boat together and knowing that we were fighting the disease together was inspiring for sure. And the way that the community, like I said, kind of rallied around us and helped lift us up. I think it was wonderful. And to silver linings, I think we've also been able to really leverage virtual care a little bit more robustly, and it really kind of kicked healthcare in the butt a little bit as to some of the expeditious elements that we need in order to make healthcare more affordable and greater access.
I think a lot more people got connected to my chart during the pandemic as well.
Exactly, yeah. So we're definitely leveraging the momentum of the pandemic to continue this wonderful just growth that we have an opportunity to bring additional services, more subspecialty services, and really make sure that we're bringing things to the local community from an access perspective without people having to travel. We serve a very rural population, not Jackson specifically, but we cover 9 counties surrounding Jackson County, which is quite a large geography, and some of that is quite rural. So really making sure how can we bring services to the local community so people don't have to travel has definitely been a launch pad since the pandemic.
Yeah, Henry Ford's looking at Jackson as, well, it's called Central Market, but Jackson's the hub of Central Market, and it's a while it's a local hospital, it is also it's a regional hospital.
That's correct. That's correct. And we have 55 different ambulatory clinics as well as the hospice home. And we have a very robust home care division. So we really do reach more than just with the hospital proper.
And during the pandemic, some things that changed at the hospital, like the masks, that's probably going to it's probably going to be the new standard in a healthcare facility.
Well, I would hope not. I would love for masks to go away, at least in the general public areas. Obviously, masks are always required when you're either in an isolation area or the surgical suite and that sort of thing. But for now, yes, given COVID protocols and state laws, we are abiding by the mask policy when in a healthcare facility. But nobody wants those masks to go away more than I do.
I know. Well, I've been in a situation where I've been, talking to people in a healthcare, at the hospital. I was there last week, and it's become so common for someone that's working, wearing a mask every day, but they've got to be tired of it.
Oh, it's hot, and the biggest thing is it's really hard from a patient experience perspective. We like to put up signs that we're smiling behind our masks and we have to smile with our eyes, but you are covering a big portion of your face.
Yeah, and a lot of people, like me, I depend on being able to see someone talk to fully understand what they're communicating.
Exactly, and the masks definitely muffle that. Yeah, so more to come on that. We'll update as things change.
All right, stay tuned. Last week, I was at the hospital because it was the opening of the milk bank, and I learned a lot, not being a mom, but this is the first milk bank at a hospital here in the whole state, and it's the first for Henry Ford.
Oh, yes. Oh, my gosh. And we are just so very excited that it's opening. There's going to be a ribbon cutting in June, and special thanks to Senator Stabenow that helped us get the funding from the grant in the state of Michigan in order to help us open it up. But it's really going to provide huge access to women in the community as well as across the state, like you said. And we're even looking at expanding into even shipping to other areas as well as needed. But really the focus is going to be on our current community. With the shortage during COVID of formula, it really heightened the need for this sort of service. So we're just thrilled. And I had no idea what it took in order to open a milk bank. But we learned all kinds of things about USDA and processing and testing. And so it's been a learning experience. But the team over there has just done an absolutely wonderful job. And we'd love for you to come out to the ribbon cutting in June.
I'm sure we'll be there. And this really came about, it's not because of the formula shortage. This was already in the works before that.
It sure was. It sure was. It's been many years in the making, so it will be a celebration for sure.
All right, so new services. We've got new physicians. You're constantly bringing in new doctors.
Oh, yes. And that is one of the biggest pluses to our affiliation with the Henry Ford health system as a whole. The access that we have not only to specialists, but subspecialists and enhanced recruitment. We also have a relationship with MSU Health, which is also bringing new specialties and newly trained doctors to our geography, both from a virtual perspective as well as on-site presence, which is allowing us to do additional procedures that used to have to leave the community. It's truly a success story.
Big announcement just a couple weeks ago in Detroit. Henry Ford is going to build a brand new hospital, and it sounds like it's the cornerstone of a whole section of Midtown Detroit that is going to serve obviously the community, but also be affiliated with universities. I think Wayne State right?
Yeah, and MSU.
And MSU,
Yep, absolutely. We call it Destination Grand. And so it's really a multifaceted strategy in order to really think about how do we bring health upstream. So there's a robust clinical research facility that's going to be built through the partnership with the Detroit Pistons. There's going to be enhancements to the Performance Center, as well as it will allow us to turn our administrative space into revenue generating retail space. So there's definitely a financial benefit there. And then to the new hospital, it will allow us to do higher acuity, and we have an aging population. So really making sure that those locations, the infrastructure matches the needs of our patients is going to be extremely important. It's going to be connected to the cancer center, which is great. And then that relationship with that MSU clinical research is definitely going to end up coming to Jackson. And with our geography being so close to MSU, I really see some exciting things happening. And I'm starting a rumor that we need Destination Jackson after we learn about the wonderful things that we did over in Detroit, because there will definitely be a halo effect in elevating the brand, and give us some ideas on how we can really elevate it here locally.
That's great. So you just coined the term Destination Jackson, so we'll start using it.
All right, you can hold me to it.
Yeah. So we've got new docs. There's some new specialties, new services that you're contemplating.
We're really enhancing all of our specialties. We did recruit a subspecialist in ENT who's doing some new sleep apnea procedures now. We are also always looking for, I know that the biggest gap in our community is dermatology services. So we are trying desperately to recruit that specialty as well. But, we have a very robust robotic surgery department, and we actually recently have a robotic surgical equipment to our ambulatory surgery center as well. So really thinking about, again, where can we expand services so that people don't have to come to the hospital if they don't need to.
Nice. Well, if you're looking for dermatologists, they're all in Southern Florida.
And Miami.
Yeah.
Miami and California, I know.
And I talked to a dermatologist, and I said, "What the specialty really? That's where it's centered. It's where the aging population is. It's where the sun's at. Yeah,
but as you know, we have a very high skin cancer rate in this community. So really making sure that we're focusing on bringing that service back into the community is a high priority.
Yeah, you can get skin cancer in Jackson. I have, so a lot of people have. All right, so we've got challenges. Nursing, I know it's always for everyone, but overall. But at the same time, Newsweek magazine named Henry Ford Health as one of America's greatest diversity workplaces.
Yes.
And that's a concerted effort on the hospital's part.
Oh, very, very intentional. We have a very robust DEIJ strategy, which is diversity, equity, inclusion, and justice. That strategy for the entire system. We have local initiatives that feed into that strategy. But, I think it really comes down to culture and really making sure that we're embracing the diversity that we all have, both the seen and the unseen, and really making sure that we can then connect with our patients in a more connected way. But diversity, equity, and inclusion is really the foundation of everything that we do, and building that foundation of trust, both with our patients as well as our staff and one another. My goal is that people feel welcome, they feel valued, and they feel heard. Yeah,
in certain populations, they were afraid to go to a doctor because they didn't see someone that looked like them or was like them. And I know you've got awards also from LGBTQ organizations for diversity in hiring and making sure that there are people in all populations that are part of the team.
Yes, and we do training for our staff as well as our providers. And then, to your point, that the strategy around intentional hiring and making sure that we do have providers and staff that represent the community is extremely important.
Nice. Well, we appreciate your time today.
Yeah, thank you so much for having me.
Great to see you.
Yes, nice to see you.
The president of Henry Ford Jackson Hospital and Central Market, Emily Moorhead.